Okay, absolutely no sugar, including no fruit and no sugar substitutes. Large amounts of acidophilus, large amounts of garlic or aged garlic. You know, the problem is that when it's Kyolic garlic is okay, but not quite as good as raw garlic. Time-release caprylic acid, mathaki or Paudarco tea for the tannins. And when you do all those things simultaneously, usually the yeast goes into remission. I use massive doses of nystatin powder only about 1 out of 5 patients. If this other doesn't completely get it, and I sometimes think that the ones that don't get better on this basic program are really not following directions completely. So we give them massive doses of nystatin. People are funny. They love drugs. I mean, I swear to God, it is amazing. I can talk till I'm blue in the face about garlic knocking out yeast, and yet all they can hear is nystatin. And then every once in a while, about 1 out of 10 or 20, they will use diflucan. But I haven't had to get into any of these other massive drugs. But we use huge amounts of nystatin. You know, the nystatin that's used by a lot of doctors come in these little sugar-coated pills, which don't have much nystatin. And anyway, how come you give sugar-coated pills to anybody with a yeast infection? I can't figure out. Anyway, see, the reason why they work is that if you take an average person, it's easy to get rid of yeast infection. You just knock off 90% of the yeast and they take care of it. But the patient with chronic diseases get this chronic candidiasis thing, which isn't exactly an infection. It's an acquired allergic reaction to this yeast, so that the normal amount of yeast that a person has in them, they are having an allergic reaction to it. And so that's why we have to be so absolutely fanatical in getting rid of it, you see. And you never can get rid of it completely, because you have it on your hands, your food, your partners, and all that have yeast. And so you're reinfected with it all the time. So you've got to keep suppressing it constantly. And that's why I like to use this anti-yeast program, that if necessary, you can keep it up the rest of your life. And you don't have to be taking a drug the rest of your life.